Hey everyone, Dr. Dale, and we got a great show in store for you today. We're going to talk to a family who are able to restore their health and get off of every single one of the medications in this trash bag right here. I'm talking, they got off of ADHD medications, asthma medications, depression medications, you name it, they've probably gotten off of it and gotten well through the power of chiropractic. We got a great show. Stay tuned. So here we are with the Sizemore family to talk about how they were able to recover their health. And I do mean that. They were able to recover their health. So Susie here, she had 2 back surgeries. She had back problems for quite some time prior to that. We also know that because she dealt with amenorrhea, which is basically an absence of your menstrual cycle. She dealt with that for many, many years throughout her life. She'd have very heavy periods. Those health issues went on after the back surgeries to developing Crohn's disease, infertility, and then phantom stomach pains. And this is Susie. That's what she dealt with. Now, her daughter right here, Natalie, dealt with, at 8 months old, she develops asthma, was hospitalized several times with pneumonia, bronchitis, and RSV. Had to go undergo breathing treatments and use inhalers. Leah, we'll get back to Nathan in a second. Leah, the other daughter, she had Asperger's and ADHD was two of the things that she was dealing with. And then Carly on the end there, lovely Carly, she was dealing with anxiety, depression, and ADHD as well. And then Nathan, the father, he dealt with back problems and foot problems all his life, and all of them have now healed. And little old Nolan, who ran off on us here a second ago, he is actually what we consider in the chiropractic world a chiro baby, because Susie was able to recover her health, get well, and no longer was infertile. So we're going to be talking about all these conditions and how chiropractic was able to facilitate their healing and allow their bodies to heal. So, Susie, how would you like to start? You came in. How did you actually find our office?
I was referred by a friend, Michelle Hughley. I was really scared to come in because I had been to a chiropractor before. I'd gotten an adjustment, and after the adjustment, I had another herniated disc. So I was afraid that he had done it, regardless of how bad my back might have been. I was afraid to come in.
Yeah.
And she said, "Dude, just do it."
Well, thank you, Michelle.
I came in. I was adjusted, and started my menstrual cycle. And do you remember I gave you a call? I was at Walgreens in the bathroom crying because all of a sudden I don't know if I should say this or not, I had a tampon in.
Okay.
And the blood just a gush of blood went through, and it went all over the floor, and I was freaking out. I didn't know what was going on. And so I called Michelle, and she's like, "Call Dr. Brown." I'm like, "I don't want to call Dr. Brown and talk about my menstrual issues to a man I don't even know." And she goes, "Just do it." And I'm like, okay, I'll do it. So I called you. I was really upset. I was crying, and you said, "Come back in. Let me do another adjustment. Give me a second chance."
Yeah.
And so I came back in, I gave you a second chance, and I brought my whole family.
Well, it took a level of understanding there to understand that, the fact that you dealt from your 20s or even when you started your menstrual cycles in your teens. Susie, again, you have to understand that she dealt with basically absence of her period for long periods of time.
Yes.
And you would have then very heavy bleeding all of a sudden. So it was like your body kicked in, knew it needed to have a cycle. You go into cycle, but it was not a regular schedule. So it was building up.
Right.
And what the power of the adjustment did was that very first adjustment took enough pressure off those nerves, your body started regulating properly and wanted to go into that cycle, that natural flush that needs to happen in the female body. So it was a good thing. It was scary.
It was.
I have people with constipation that all of a sudden no one's walking around here on the set, but it's awesome. But what happened was your body was going into a healthy response, needing to flush and clear itself. Like I was saying, I have patients with constipation, all of a sudden they start to have diarrhea. Their body kind of does the opposite. So you went from absence to a full-on
Right.
flush of the
It was
system.
almost, I had had a miscarriage before, and it was that much blood.
Yeah.
And I knew I wasn't pregnant, so
Yeah.
it was really scary.
Yeah. But then you continued getting adjusted, and how did your cycles go about after that?
They became regular.
Susie, you went through 2 back surgeries. I remember what was really cool. You were a soccer player, like you played in college, so a very physical sport. You underwent 2 surgeries due to herniated discs in your lower back, and then after that, you developed Crohn's disease. Tell us a little bit about your experience with Crohn's disease, an autoimmune disorder.
Well, I had a lot of diarrhea, a lot of
Okay.
stomach pain. I hurt all the time in my stomach area. The doctors called it a phantom pain. In order to deal with the phantom pain, because they didn't realize it was Crohn's disease.
Yeah,
they
that was
would give
before
me-
you were diagnosed with
Yes,
Crohn's.
they would give me antidepressants and sleeping pills because
No.
they thought they thought there was something wrong in my head. You
Yeah,
know?
so...
And that caused depression. So,
Well, I mean, when people are, I mean, I
Yeah.
could just imagine if somebody's telling you, oh, this is all in your head, but you're like,
Right.
no, really, I'm afraid there's something seriously wrong
Right.
with me. And they couldn't explain it, so what they do, it's all got to be on your head.
Yes.
So they were close, it was in your spine,
Yeah.
nervous system, brain's
Okay.
kind of, that's a little Cairo joke for you, but anyways.
So I didn't want to take the medication for the rest of my life.
Yeah.
And when I was there in the doctor's office asking the doctor, what are my options? How can I change my life so I don't have to be on this medication anymore?
Yeah.
He said, there's some pamphlets on the wall. Why don't you read them? So there wasn't any comfort whatsoever at all.
Wow.
And so I knew I had to make a major change in my life. Not only with coming to you, but also in my eating habits. I couldn't continue to eat the way that I was eating
Yeah.
and expect the same,
Yeah.
different results.
Yeah. So we began to adjust you. We helped you with your diet, changing your diet, doing those things. You were able to get off the Crohn's disease medication.
I maybe was on that medication for a week.
Oh, really? Wow.
It was also sad because I'd been a soccer player. I used to run a lot,
Yeah.
and I missed that because once I had my back surgeries, my activity went way, way down low. And I wasn't able to go exercise like I used to be able to. And I wasn't able to enjoy my children like I was able to, am
play
able
with
to
them
use
and
them.
do-
I wasn't
yeah.
able, Nate had become the parent. He
Yeah.
became the mom and the dad, and he had to take care of my kids.
You kind of took on a lot of the roles
Exactly, and
to
I
make
was
up
not
because of your health.
active with them. Because of you and because of God,
Yeah.
I've been able to do a 360, and I'm able to be very involved in my children's lives now. I homeschool them,
Yeah.
now. So
So let's reiterate real quick. So the back pain you used to suffer with is almost nearly gone.
It's gone.
Even after the surgeries that pretty much failed because you continued to have back problems and pain. The phantom pains in the stomach and stuff
are gone.
gone. You have regular periods now, which what was really amazing is no one's been walking around here. The little guy you saw at the beginning of the show, this little baby boy, you guys had 3 girls, and then all of a sudden you're told, now that you have these menstrual issues and hormone issues, that you'd never be able to have children again. So you're basically diagnosed with infertility, is
Yeah.
that correct? And then you started having regular cycles. What happened to your hormones too? It helps a lot of ladies. Let them know.
I didn't have a sex drive,
Yeah.
and I started getting adjustments, and it increased.
Good for you, Nathan. Good for you. But the reality is, what's amazing is, I joke about that, but that could be a lifesaver to somebody's relationship, to somebody's family, because the power of adjustment through restoration of the nerve flow out to your sex organs, your reproductive system, not only brought a new baby boy into this world, but enhances a relationship. So, thank God for that. Hey, I'm Dr. Dale, and by this point in the show, you're probably wondering to yourself, how in the world did this family get off of every single one of these medications they were on? How in the world did a mom overcome infertility and Crohn's disease, a severe digestive issue? How did she overcome those health conditions under chiropractic care? Let me give you a brief explanation of how that can occur in someone's body. See, when we do very specific work in my clinic, we work on the spine. To look for anywhere in the spine, we want to see and find where there's a subluxation, which means a misalignment of the spine that's interrupting and basically causing a miscommunication between the brain and that organ. That's what a subluxation is. So we were able to determine several levels of subluxation in this woman's spine, the mom. And we're giving the mom as the primary example here. So she dealt with Crohn's disease, a severe digestive issue in her lower colon, and then she also dealt with infertility and amenorrhea, which basically means absence her menstrual cycle. So she wasn't having a period on a regular basis like she should. So what we found was severe misalignments in her lower back. She even had a back surgery at one point in time because she damaged her lower back so bad. She was a soccer player. That's probably what happened. So because of those injuries, because of those misalignments, her brain was no longer able to communicate out to her digestive tract properly, and that was causing that miscommunication to where she was building disease in her colon, and they were diagnosing it as Crohn's disease. Now, infertility, the communication wasn't getting out to her reproductive issues, basically just a couple levels next to where the nerves branch out and go to the colon. So after correcting the misalignments in her lower back, her brain was now able to communicate out to her digestive tract and reproductive organs properly. It restored that normal function. It's kind of like put a rubber band around your wrist. Leave it there long enough, eventually you're going to lose function in your hand. This is simplistic. This is not exact. It's a simplistic way to explain it. But if I put a rubber band around there and I leave it on there, I lose function in my hand. Well, what do I need to do to restore function in my hand? Remove the rubber band. We removed the misalignments in her lower back, removed and corrected the subluxations. Brain was able to communicate and her body healed. That's how we get people healthy in my clinic. We're going to continue on with the rest of the family and their health problems. And, Natalie. So Natalie dealt with several health problems, pretty significant health problems as a child, correct?
That is correct.
What kind of things were going on with her?
She was born premature, or you can call it premature, at 32 weeks. And
let's touch on that real quick. Since you just mentioned that, you had told me that Natalie, Leah, and Carly, so all three of your first children, had been born at around 36 weeks. Is that correct? All of them fairly early, that you weren't able to carry full term.
Right.
And then they said with your son that it would be almost impossible to carry full term as well because of your history of health problems and things like that. And then how long did you carry your son because you were doing the right things to get healthy and well?
He was due on the 27th of September. I had him on the 21st, so 6 days early. So almost 40 weeks. Almost
40 weeks. So you carried him a lot longer than people expected.
Yes.
And that's the reality is, the reality is this: if the body is not in a condition where it can take on that stress of during pregnancy, then the body's going to I believe the body's going to go ahead and let the baby come out a little bit early, though it may be somewhat detrimental or unsafe, but it's the best thing for that time. But the reality is, if we can get the body healthy, then the healthiest and safest place for that baby is in mom's belly,
Exactly.
And you're stronger to be able to carry full term.
And I'm much older. I'm 40.
Yeah, and so that was another risk factor,
Yes.
but this was the best pregnancy you had, right?
Yes, I enjoyed it. I didn't enjoy the other three.
Oh,
I enjoyed this one.
They enjoy having you, girls.
I enjoyed having you. But it was miserable. It was miserable, yes.
But yeah, that's what's amazing. We can also help pregnant women, throughout pregnancy, be more comfortable, less back pain, less... hormone issues, more active, just, with better alignments because of their spines. So back to Natalie now. So she was an early baby.
Yes.
She spent time in the hospital?
Not much time.
Okay.
They did a few tests on her. She didn't pass her hearing test 3 times. But we took her after we got her out. She passed the hearing test, but then she started having breathing issues.
What was the birth process? Was she forceps or any kind of extraction type?
All my kids have been, they do Pitocin because of labor.
Okay. So stronger contractions for you then.
Yeah.
Was there any assistance from the doctor by hand or anything? Okay.
No. So she comes out. She's what I think is a healthy baby.
Yeah.
We bring her home and she...
Well, there was the issue. The placenta would not deliver.
That's right.
Oh.
So when
I bled
they
out.
removed it, she bled out.
Wow.
So for whatever reason, the labor thing just shut down right after the baby.
I bled out. My blood pressure went 60/40. Is that right? I told the doctor.
Like that.
I think I'm going to go to sleep now. They did my blood pressure. They're like, holy cow, 60/40. They gave me some shot in my leg. It was a really big one. It brought me back.
Yeah.
And then we had a beautiful baby girl.
Yeah.
And a few months later, I was up with her. She was having a hard time breathing. and we took her into the hospital and found out at 8 months that she had bronchitis, pneumonia, and RSV.
Wow. All three of those things
All
at the
three
same
at
time.
the same time. She was in the hospital for 3 days. She was lethargic when we brought her in. Her oxygen level was at 80%, and they diagnosed her with asthma.
Okay.
And from then on, anything, Christmas trees, colds, change of weather, pets, we had to get rid of our dog, would make her asthma.
You had to get rid of man's best friend?
Yes.
Because somebody's health. I could never dream of getting rid of my dogs. I love my dogs. And, but that's what people do for their children if they're unhealthy. But, the reality is now.
Yes.
Where has she come from? Getting adjusted, getting the right alignment to her spine.
Awesome, because Nate moved us here to Tennessee, and we were in North Carolina. We had hardwood floors. Her asthma, I thought I had under control. We move here, and it flares up again. And someone said Tennessee's the worst place to live if you have
supposed to be like the
allergies.
allergy state or something like that. I'm like, I never dealt
Nate,
with this.
You moved me here, and now our daughter is gonna die. And we started having to take her to the doctors more, and I'm like, holy cow! She had to take an emergency inhaler to school, and I'm just like, what are we gonna do?
Yeah.
And you were our solution. She started getting adjustments, and we've been 3 years. She hasn't had any inhalers,
3 to 4 years,
any breathing treatments, and nothing.
Yeah.
And the weather can change. She can be around a sick person, and nothing. It's wonderful.
Yeah.
And she used to complain about her lungs hurting all the time. Mommy, it hurts to breathe. So she can go outside and play and have a good time now.
That's awesome. I mean, what's amazing here is we're going to have so many different conditions that this family dealt with, where their health was, and all because of restoring the natural communication between brain and body. You're able to heal and function. When you look at so many health conditions, they know for a fact that a weak immune system and asthma is a neurological problem. They understand that absent menstruation, it's a problem with communication. It's not a problem with hormones. It's a problem that your hormones don't work because the systems and the organs aren't functioning properly. Well, controlling those functions is the nervous system. So if you can get that connection back, the body heals. So now I'd like to ask you a question. Do you remember being a child and, before you came in, having those health problems and breathing issues? What was that like dealing with?
I didn't enjoy it at all. I remember when I had breathing treatments and I had to wear this thing on my nose and my mouth, and I had to breathe in and out. And I hated the sound of the machine.
Yeah.
I just didn't like it. I would look in the future and say, will I be like this forever, or will I just stop? And I stopped because of you.
Thank you. What's life like now?
Awesome.
Okay, that's all we got to say. That's awesome. Let's move on to Leah now. Leah dealt, and she was diagnosed with Asperger's and then ADHD, right? Leah, how you doing today?
I'm doing good.
Okay.
She's writing novels now.
She's writing novels now?
Yeah.
So, that may be, and the same thing for Carly. So we'll kind of feedback that both of them dealt with a few, and this is the reality. Girls, you're amazing, you're smart, and you're doing phenomenal now that you're healthy and well. But the reality is both of you are diagnosed with childhood cognitive or mental conditions and Asperger's and ADHD or anxiety. So, what's amazing is seeing them change. Like I remember Carly coming in and literally being afraid of everything.
I hid under the table.
She hid under the table. Yeah. I totally forgot about that. She hid underneath my adjusting table. And then Leah, I remember it was difficult to have a conversation with her and just wasn't, but now it's great.
She connects with you.
Yes.
As before, she didn't connect.
So tell us a little about Leah's history and dealing with the Asperger's and ADHD prior to getting adjusted.
At the age of 5, she was diagnosed with Asperger's. I always knew
She was delayed in her development. Her reading, she wasn't reading where the other preschoolers were, and we knew she was smart, but we didn't understand what was slowing her down. She, even at birth or from birth, she was delayed in speech, walked a little later.
Yeah.
Just didn't keep up with other kids.
She used to
We
flap
didn't
her
really
hands.
understand.
Used to flap her hands. I
Flap her
remember.
hands and her feet.
When she would get excited, she'd
Yeah.
do things that, was
Like the
typical of
overstimulation,
Asperger's.
kind of like
Yes.
with children dealing with autism or PDD and those different
Right.
And she
cognitive
used to
disorders.
Exactly.
scream when she was a newborn. She would just
Wow.
scream, and it was like she was in pain.
But nobody could figure out what.
And I would
yeah.
take her to the doctors, and they said it was normal for her to scream like
It
that.
is
And
not.
the only thing that would comfort her was for us to hold her, and we couldn't
Yeah.
hold her face in. She wanted to be faced out.
Wow.
And it was just awful not knowing as a parent what your child needed.
Yeah.
And the
But
doctor
knowing they
saying
need something.
it's perfectly normal. And I'm like, no child should
No.
scream like that,
No.
like they're in pain.
I mean, I've adjusted so many babies dealing with things like colic or fussy or crying or screaming, and you know the child's in pain.
Mm-hmm.
And, that a baby could have a pinched nerve, everybody, from the birth process, coming down the birth canal to forceps delivery or vacuum extraction, those things. Babies need to have their alignment checked, their spine checked for subluxation, because that makes me frustrated as a physician to know that we could have helped her and helped you guys have a better life in her as a baby. Maybe you don't remember as a baby crying and screaming, right? No. She doesn't remember it, but the reality is still there was a life suffering there and didn't need to suffer if we would just implement the most important aspect of your health is the alignment of your spine. If we would implement chiropractic into aligning and making sure, maybe we don't need to adjust every baby, but we need to make sure that they're in alignment at least. So, where's her health at now?
It's phenomenal. It's awesome.
Yeah. What has improved? You said she was writing novels now.
Yeah.
What's like your interaction with her and stuff like that? And Leah, how's your interaction? How do you feel now that you're able to function, day to day, right?
Yes. I remember I didn't give people eye contact.
Yeah.
Which, that's just typical.
Yeah.
Asperger's.
Yeah. What are some other things that you saw improve or anything like
She
that?
didn't
How are you
feel-
doing in school? That's what I would like to ask.
She's doing awesome.
Yes.
And
Kinda-
she had a hard time communicating with people. She didn't
Yeah.
feel like it was important to have friends.
Yeah.
It was all about her. And now she's
So you're
making
like the
friends.
non-social.
She is so funny. She's making up these Bible stories right now with a twist, and it's so comical,
Yeah.
And I mean, it's something she wouldn't have done before.
And now you're writing books. Are you going to write some Christian Bible books and stuff like that to help people learn? Maybe kids? That would be good. I think you should do that. Maybe we just thought of that right now. Maybe that was God speaking through me saying, hey, Leah, this is what you need to do with your life now that you're able to just be healthy and well. I love that. I wanted to touch on the medications being used to treat ADHD. How did they affect your children?
It
One of
made
your
them
children?
zombies. Carly would say, I feel like I'm trapped inside myself. And
Wow.
I had to wrestle them down to the ground and try to force these pills in them, and they would
Yeah.
fight me. And I'm just like, I'm doing what the doctor's telling me to do. These are what your teachers want happen so you can sit there and focus. And
Yeah.
Carly's like, I'm not able to focus. I'm trapped in myself, Mom.
Yeah.
Please don't make me take this. And I thought I was doing what was right.
Yeah.
And unfortunately, it was not what was
Yeah.
right for
How did it affect Carly?
Carly was also in Selexia because of her anxiety.
Okay.
I can remember driving in the car, and it's like 30 degrees outside, and she's wanting us to roll down the windows because she feels like the car was coming in on her. And so here we are all freezing to death and having to hear a child, you got to keep the windows down, you got to keep the windows down, or Mom, there's someone outside my window trying to kill me. She had these.
So she was hallucinating.
Yeah,
She was
she didn't want to take the
on the side
Selexia.
effects of the medications.
But I was giving it to her because the doctor said it was what was right. We were going to a psychologist at the time, and that is what they were prescribing her
Yeah.
to help her, and it
Yeah.
was making her life horrible.
And now you guys are off every single one of the medications you were on.
Holy cow, she has done like a 362. She used to be scared of everything. She wouldn't talk to anyone. And now she's like Cinderella. She talks to everyone. She flirts with boys.
Uh-oh.
She tried to sneak in at a church dance. And She's just amazing. I mean, her
Awesome.
self-confidence. She looks
Yeah.
in the mirror. She's constantly doing her hair.
Yeah.
And she can't wait to wear makeup.
Oh,
and
boy.
she's like, I'm beautiful. I'm
Yeah.
gorgeous. Whereas before, she didn't feel beautiful. She didn't feel gorgeous. So it's been wonderful to see the butterfly come out of the cocoon.
Yeah, that's awesome, and that's a good way to put it. And that's, basically all of you have been able to overcome health adversity, get off of medications, get well, get healthy, and little Nolan's with us now. Now that you had 3 girls all in a row, you're blessed. Lord blessed you with a little baby boy because you were able to recover your health through spinal, alignments, allowing it to.
There's no way I
Yeah.
could be as active as I am now with having a little 14-month-old running around. If we were to take this back 5 or 6 years ago,
Yeah.
because I
Before
didn't have the
getting
energy.
adjusted.
Yes, I didn't have the energy.
Wow. All right, so just to sum it up, what's amazing, and I thank the Sizemore family for their time and being amazing patients, being on purpose. Not only did you guys get well, but I know that I've seen so many patients come through my doors, individuals suffering, who are sick, who are on medications, with children with problems and allergies and all kinds of stuff. And because of the testimonies that you all have, you've been able to bless others' lives. And that's what we want out of this show, is we want people to see that they can be healthy, that they don't have to have their children be put on medications that cause them to hallucinate and do harmful things to themselves or others, or a mom that's been told she can, or a mom or just a wife, a woman that cannot have a child, be told, you're infertile, you'll never have a child. You know what? That boy right there, Nolan, is a testimony to the power of your body's ability to heal if you just get the power turned on, if you allow the brain to communicate out to the body. So in celebration, what we want to do is we want to show everybody what this was the bag. This is the family's medication cabinet. So they brought it here because what they did was, after a time period, I forget how long it was.
It was hard for me to let go of all that, too. You came to me and you told me, you said, I want to commit you. I need you to bring me all your drugs. And it took me a while because I thought, I need them just in case,
Just in case. What I told her was, at a moment in time, I was saying, your family is getting well, is getting healthy. I'm like, Susie, it's time to commit your family to being so healthy, so well, that you don't need a crutch anymore. You don't need medications anymore. And so what I did was I told her, bring your medications in. Get rid of them. Get them out of the cabinets.
Nate thought I was a nutcase.
Decide to never go back that direction. Decide that health is what you're going to stand on. And you're always going to look for the cause of a problem. And that's what I want to teach people as well today, is that you need to look for the cause of a health condition. Because medications, this junk, this trash right here, does not heal your body. It does not correct the problem. The cause of the problem is still there. Your body is still deteriorating. You're still unhealthy if you're just taking a medication. These are a bunch of pieces of duct tape for all we could, for all we care. But look at this. The family is off of all of those medications right there. We got one more in there. ADHD medication, anxiety medication, asthma and allergy medications, depression medications. What else we got here? We got pain medications.
Pain. Lots of pain medications.
And all that, every one of these things, done. No longer necessary because your body is healing the way God intended it to. So, we can kick that stuff around. So, So, thank you so much for sharing your testimonials with the world.
Yeah.
Thank you.
We have so much more information we want to share with you. So stop by our office located at 1715 Wilma Rudolph Boulevard, Suite E. Subscribe to our YouTube channel and like our Facebook page to receive more information from Dr. Brown.